I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. When Nobel Prize winner Linus Pauling wrote Vitamin C in the Common Cold, he created an ongoing controversy. This is the People's Pharmacy with Terry and Joe Graydon.
Back in the 20th century, many physicians honored Dr. Linus Pauling for his research in the field of biochemistry. He's the only sole recipient of 2 Nobel Prizes, one of which was for peace.
Dr. Pauling's research about vitamin C was scorned by the medical community. His ideas about the common cold and cancer were rejected.
Today, we'll learn about the evidence on ascorbate for these conditions.
Coming up on the People's Pharmacy, vitamin C studies on colds and cancer vindicate Dr. Linus Pauling.
In the People's Pharmacy Health Headlines, shingles vaccinations are designed to improve the immune response to the chickenpox virus and reduce the likelihood of a shingles outbreak. A few weeks ago, we reported on studies linking the shingles vaccine to a lower chance of developing dementia. Now, researchers have analyzed data from South Korea on more than 1 million people over 50 years old. People who received a shingles vaccine were at 25% lower risk of major cardiovascular events. They appeared to get protection from heart failure, stroke, and heart rhythm disturbances, as well as heart attacks. This protection was apparent for up to 8 years after vaccination. The investigators suggest that shingles vaccine should become part of a public health strategy.
According to the Alzheimer's Association, over 7 million Americans now have Alzheimer's disease. Over the next 25 years, this form of dementia is expected to double. There are no medications that prevent AD, and the drugs that have been approved in recent years barely slow the decline. A new study published in the Journal of Alzheimer's and Dementia reports a novel use for certain HIV drugs against AD. Researchers analyzed medical records from the Veterans Administration and a private insurance company for as long as 24 years. There were a total of 270,000 subjects included in the study. People taking a special kind of HIV drug called nucleoside reverse transcriptase inhibitors were less likely to be diagnosed with Alzheimer's disease. People taking other types of HIV medications were not protected. The annual reduction in AD cases ranged from 6% to 13%. The senior author of the study speculates that such drugs could prevent approximately 1 million new cases of Alzheimer's disease every year. The FDA is likely to require randomized controlled trials.
In 2023, the FDA approved the drug lecanemab to treat Alzheimer's disease because it reduces brain amyloid and seems to slow cognitive decline slightly. At the time of approval, scientists recognized that the drug could cause brain edema and bleeding. These and other problems might show up as amyloid-related imaging abnormalities, or ARIA. Doctors at a memory clinic have now used this drug to treat 234 patients over the course of 14 months. 37% of these patients had infusion-related reactions, and 1/5 had ARIA. About 6% of them had symptoms due to brain swelling or hemorrhage, with 1% suffering severe symptoms. The authors conclude that these adverse events are manageable.
A few weeks ago, the FDA announced that it would be asking food companies to get rid of petrochemical dyes in foods, beverages, and candy. The new FDA commissioner said that natural alternatives should be substituted instead. This week, the agency approved 3 new colors derived from natural sources. One is calcium phosphate, which is white. It's long been used in fortified plant milks and packaged breads. A blue, greenish, or purple color has also been approved. It comes from the butterfly pea flower and has been used for about 4 years in juices and candies. Finally, a bright blue, almost turquoise color is derived from Galdiera algae. It will be used in smoothies, milkshakes, popsicles, yogurt, ice cream, and candy. As more natural food dyes are approved by the Food and Drug Administration, it's hoped that synthetic food colors like red dye number 3 will disappear.
A new treatment for uncontrolled hypertension has cardiologists excited. It works through a completely different pathway. When people can't get high blood pressure under control, it's called treatment-resistant hypertension. A study in the New England Journal of Medicine showed that the investigational new medicine, lorundrostat, lowers systolic pressure by about 15 points. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. In 1970, the Nobel Prize winning chemist Dr. Linus Pauling published a paperback book titled Vitamin C in the Common Cold. That little publication set off a firestorm of controversy that continues to this day.
Most of the American medical establishment rejected Pauling's claims that vitamin C could help people recover from the common cold. They were especially dismissive of the idea that vitamin C might be helpful in treating cancer. However, there have been some studies conducted over the decades since then. The weight of the evidence now seems to vindicate Linus Pauling. Let's hear more about that.
We begin by talking with Dr. Harri Heimela. He is a senior researcher, principal investigator, and adjunct professor at the University of Helsinki in Finland. Dr. Heimela has published several comprehensive reviews of the evidence on vitamin C for the common cold.
Welcome to the People's Pharmacy, Dr. Harri Heimela.
Thank you very much for inviting me to this phone call.
Dr. Heimela, you have a degree in medicine, medical doctor, but you also have doctoral degrees in biochemistry and epidemiology. This is quite extraordinary. 3 major degrees. How in the world did you get interested in what I think a lot of American scientists would say is a rather mundane issue, vitamin C, and what we call the common cold? How did this pique your interest?
When I was young, that means about 20 or something like that, I was looking at a TV program of Linus Pauling, very famous US chemist who was interested in vitamin C, and he was proposing that it is useful for the common cold. That was not the only reason for my interest, but there was another program which challenged this benefit of vitamin C, and I was interested in the conflict between these 2 opinions. So I was doing some basic research in biochemistry, but I had this vitamin C field going over decades until now.
Dr. Heimela, you have written extensively about vitamin C and the common cold, and I think our listeners would like to know what you have concluded and how you got to that conclusion. So that's a big question. Maybe you could break it down. Let's start with what you've concluded.
There are several dozen randomized trials on vitamin C for the common cold. They have many kinds of differences, how long people are given vitamin C, what is the dose, and so on. But in my meta-analysis of these trials, I have shown that in adults, vitamin C on average shortens colds by some 10%, and in children about some 20%. So the effects are not huge, but they are real. There is very strong evidence for these effects.
Why do you think American researchers have been so negative about vitamin C, they've devoted a lot of time and energy to what I would call debunking Linus Pauling? I have a copy of the original book titled Vitamin C and the Common Cold. It was published back in 1970, and it seems like most American researchers have spent a lot of time trying to convince their colleagues that it was worthless. It's almost a cultural thing.
Yes, I fully agree with you. There are different lines of reasoning to explain the attitude of the mainstream medicine. One is that vitamin C was identified as the explanation for scurvy. And scurvy is, of course, very different compared to the common cold. And my interpretation is that this focus on scurvy is one of the historical reasons why doctors have been so reluctant to take these studies seriously. And another explanation, which I think is that there is so much exaggeration of the vitamins. Much of this exaggeration is clearly there is clearly no basis for many of the claims which are used to sell huge amounts of vitamins. So I think that these two directions are the main explanation.
Dr. Hemila, do we have any idea of how vitamin C, ascorbic acid, might work to reduce the duration and possibly even the severity of what we call the common cold, which actually is kind of a big term for a lot of different potential viral infections?
I think that the most simple explanation in this kind of forum is to say that it works as an antioxidant. We know that in infections there is production of free radicals, and vitamin C can be effective against them. But it has a very long list of biochemical effects, and of course it is not possible to say that it is only this antioxidant effect which explains the benefits. But we also know there is strong evidence that in many infections the level of vitamin C in body is decreasing. And that means that there is some kind of increased need for vitamin C during infections.
Dr. Hemila, can you give us a little sense on dosing? Because there is quite a bit of controversy about, well, how much vitamin C is necessary to be beneficial, how much is toxic. You know, the average nutritionist here in the United States says, well, you don't need a supplement. All you need is a glass of orange juice and you'll be fine. Tell us about dose. Tell us about safety.
This dose range question is very complex because we can prevent scurvy with 10 milligrams. That is one level. The average intake in USA is about 100 milligrams. So the dose intake is much higher than to prevent scurvy. But in the vitamin C studies, the highest doses that have been used are 6 and 8 grams per day. That means 6,000 and 8,000 milligrams per day. And they have been shown to be beneficial during the common cold. I don't see any evidence that an ordinary person in ordinary good health has a benefit from vitamin C over the 100 milligrams per day. But the strongest evidence is that during common cold, it is worthwhile to try these very high doses.
So it sounds as though if you started to come down with a cold, it might make sense to really take a lot more than just a glass of orange juice.
Yes, surely, yeah. And this is not my opinion, but I have carried out meta-analysis of dozens of randomized controlled trials which show that there is strong evidence of effect. We don't have a good answer to the question, what is a suitable dose? But these 6 and 8 grams have been given to patients, and there has not been any problems of those doses. I know that people have been taking even higher doses, but it is difficult to encourage people to take such doses. These 6 and 8 grams have been used in large trials, so it's easy to say that they have been tested and shown to be harmless.
So even at 6 grams or possibly even as much as 8 grams, we don't see serious side effects?
No. If one takes long times, it is possible that there are some harms, but people have also been taking high doses for long times. But in this case, I'm encouraging my own common cold patients to take these high doses during the common cold. That means about a week or more or less, something like that.
So to help treat it while you're having the cold, but don't take it all the time to try to prevent a cold.
Yes, that is what I would say as a conclusion.
Dr. Hamila, you have also written about zinc for the common cold. And there has been a lot of research on zinc, but it has what I would call a mixed reactions. Some studies have been positive, some studies haven't shown much benefit. Can you give us a perspective on your overview of zinc and why it might be beneficial?
Thank you for inviting me to this talk. We must distinguish between two different zinc products. One is ordinary tablets, which we are ingesting into our stomach, and another is zinc lozenges. As far as I know, there is no meaningful evidence that these ordinary zinc tablets are good for the common cold. When I have been analyzing these zinc lozenge trials, I have shown that the discrepancies, some positive, some negative findings, they are explained by the doses that have been used and the kind of zinc salt that is used in the lozenge. So if we take studies which used high doses of zinc acetate lozenges, they are consistently, they are all consistent with a strong evidence of benefit.
When you say high doses, what are you referring to?
The doses in these zinc lozenges have been some 100 to 200 milligrams per day. That is much higher than the dose people get from their food, but there are, for example, some diseases, Wilson disease, where people are given similar doses for years and decades. So these are safe doses for a common cold which is lasting for a week or so.
So if you are taking your zinc acetate as a lozenge, which is the way it's going to work best, you will be taking, each lozenge will be a much smaller dose, but altogether you could add up to 100 or 200 milligrams in a day.
Yes, yeah. Of course, it is most useful to divide those lozenges so that one takes them somewhat regularly over the day, so that the total amount is somewhat over 100 milligrams.
Yes.
This 200 milligrams has been the highest dose, but there are several studies which have been using closer to 100 milligrams. So I don't think people need to take 200 milligrams.
So 100 milligrams would be about enough in divided doses as a lozenge that you suck on, not chew up and swallow right away. Are there any side effects that we know of?
Some people have bad taste and some get irritation of stomach, but these are not serious. And if one considers that the taste is bad, no one needs to continue. And if one thinks that there's some irritation of stomach, one can stop taking them.
And is there a preferred salt? In other words, we hear that zinc gluconate is the preferred form. Do you have any that you prefer over zinc gluconate, like zinc acetate, for example?
The strongest evidence is for zinc acetate, but I don't see that there is strong evidence that these are different, this zinc gluconate and zinc acetate. But this question about salt is very important in that respect, that there have also been zinc citrate products, and they are totally ineffective. Zinc binds strongly to citric acid citrate, and therefore such lozenges don't release zinc in this mouth region.
And we have heard that too much zinc for too long can deplete the body of copper. Is that a worry?
Yes, and that is the reason for using high doses of zinc for these Wilson disease patients. Wilson disease is there is accumulation of copper in this Wilson disease. But treating Wilson disease patients with high doses of zinc also shows that zinc doesn't have other harmful effects. I mean that we must recognize that it can cause depletion of copper, but if we are taking zinc for a week or something like that, it really doesn't matter.
And how effective is zinc when it comes to the common cold? Can you give us some sense of benefit?
The highest doses of zinc acetate that have been used, those trials have found that common cold is shortened by some 20 to 40%. So the evidence in that respect is greater than for vitamin C. I would assume that zinc gluconate in similar doses has similar effects.
So it sounds like if we were to combine vitamin C and zinc, we might get an added benefit. Has any such trial been conducted?
Not to my knowledge. So these are completely independent sets of trials. But one problem in this question is that in Finland here there are some products which have zinc lozenges which already have vitamin C. But I say to my own patients that it is very stupid combination, because vitamin C also binds somewhat zinc. So one should keep them separate. And also, if one keeps them separate, one can adjust the doses freely. For example, if one wants to take even higher doses of vitamin C.
Dr. Hemila, I've always wondered why we call it the common cold, given the fact that there are literally hundreds of upper respiratory tract infections that are responsible for quote unquote cold symptoms. And it seems kind of ludicrous to assume that vitamin C, or even zinc for that matter, would work perfectly for all upper respiratory tract infections. I mean, we've come to realize, for example, that antibiotics may only work for certain kinds of bacterial infections and not all bacterial infections. So we've become very sophisticated at testing antibiotics to determine which bugs they are going to be able to eradicate and which are inappropriate. So why do we just assume automatically that vitamin C should work for every single upper respiratory tract viral infection?
Actually, I would turn that argument around. We are not assuming, but we are observing in clinical trials that in several different contexts with children and adults and in different countries and so on, we find benefits. So we cannot assume that the viruses are the same in all of these. If we assume that the benefit of vitamin C comes from the antioxidant effect, that is also one explanation why the effect is non-specific. Different viruses can cause this free radical stress, and in that respect, it is quite logical that vitamin C can have effects on against different kinds of virus infections.
Dr. Heimila, we always like to get a sense of what our guests are doing themselves. And so if we could get very personal for a moment, how much vitamin C do you take on a daily basis, if any? And then what do you do if you come down with a common cold?
Quite often I take some half a gram of vitamin C per day, but that is not based on any evidence. So one justification is that it is safe, it is cheap, and there is some evidence of a benefit overall. But I don't encourage my own patients regularly to take vitamin C, but that is what I'm taking, some half a gram per day. When I have a common cold, I usually take over 10, perhaps some 20 or 30 grams per day. I don't usually encourage my own patients to take such doses. It's easier to encourage some 6 and 8 grams per day because such doses have been used in controlled trials and they have been shown to be safe.
And are there any other nutrients that you take that you think are valuable?
I take vitamin E. There was a large randomized trial in Finland with some 30,000 participants. They were followed for some 6 years, and I have been analyzing that trial, and I showed that vitamin E was beneficial for old people. It was harmful for young people, and the limit of age was some 65 years.
That is fascinating because the takeaway from that trial in the U.S. has generally been vitamin E is dangerous. It's not good, especially for people who were smokers. But there hasn't been much discussion of the fact that it might be helpful for those who are over 65.
Yeah, that's there was very much interest in vitamin E in 1980s and 1990s. This Finnish trial was actually organized to study beta-carotene, for which there was also strong interest, but they studied at the same time vitamin E. This Finnish study is the largest on vitamin E that has been carried out, and the overall finding was that it was neutral. these harms of vitamin E were found in some other trials, for example, in the USA. But because this was the largest study, it was also possible to carry out analysis within that trial, and I showed that vitamin E was beneficial for old people interests.
And just out of personal curiosity, how have you been received by your Finnish colleagues? As I've mentioned, in America, researchers who look into vitamins and in particular report on positive effects are often chastised by their colleagues. How are your Finnish colleagues dealing with your fascination and your I want to use the word perspicacity. It's a little big word.
It's a big word.
But your focus on vitamins in general and vitamin C in particular.
Yeah, they are polite, but the Finnish medical researchers, they are following the U.S. culture, and I think that they have taken much of the antipathy against vitamins, but I have not had problems with my own research here in Finland. But as I mentioned earlier, one background for the antipathy of this mainstream medicine against vitamin C is that there is so much business which is clearly unfounded. And in Finland, we, for example, also had there was one medical doctor who was selling different kinds of vitamins with promises which were clearly unfounded. I have not been doing that kind of business, and of course that is one explanation why I have not been attacked in the same way as he has been.
And what would you like to say to American healthcare professionals who have heard for decades that vitamin C is just about worthless when it comes to upper respiratory tract infections?
Well, to the professional listeners, it's very easy to give an instruction that they take a search for PubMed for my name and look what I have published about vitamin C and the common cold. For example, one is a Cochrane review, which is a highly respected forum for these kinds of meta-analysis.
And we will put links to those publications in the show notes for this show. Dr. Harri Hemila, thank you so much for talking with us on the People's Pharmacy today.
Thank you very much for inviting me to this talk.
That was Dr. Harri Hemila. He is a senior researcher, principal investigator, and adjunct professor at the University of Helsinki in Finland. His research focuses on nutrition, infectious diseases, and immunology. You'll find links to it on our website.
As you just heard, American scientists have been skeptical about the value of vitamin C for colds. After the break, we'll consider using vitamin C to help treat cancer.
Linus Pauling urged scientists to study this approach, but for the most part, they've dismissed it.
You'll hear from a cancer researcher about adding high-dose vitamin C to a treatment for pancreatic cancer.
His team went from cancer cells in the laboratory to treating mice, then humans.
Adding IV vitamin C to chemo doubled survival time for human cancer patients.
You're listening to The People's Pharmacy with Joe and Terry Graydon. This podcast is brought to you in part by Caraway Cookware.
If you're trying to cut back on the amount of processed food you eat, you're probably making an effort to cook at home more.
Caraway Cookware makes that a lot easier and a pleasure. It's so great to use this nonstick cookware that does not contain toxic PFAS chemicals.
We've been using Caraway pots and pans for more than a month now, and we love them.
When Caraway first sent us a set, I wondered how we would find room for them in our kitchen. But these beautiful pots and pans come with their own storage solution that makes it easy and convenient.
It's a delight to use these thoughtfully designed pots and pans. The lids and the handles don't get hot, and they're so comfortable to use. Plus, washing dishes is just so easy.
Just as a reminder, their iconic cookware set comes with a saute pan, a fry pan, a Dutch oven, and a saucepan, plus lids for all of them, a canvas lid holder, and magnetic pan rack for storage. It's the ultimate kitchen setup and will save you money versus buying the items individually. Plus, if you visit carawayhome.com/ppod, you can take an additional 10% off your next purchase. This deal is exclusive for our listeners, so visit carawayhome.com/ppod or use code PPOD at checkout. Caraway, non-toxic cookware made modern.
And that's spelled CARAWAY home.com/PPOD. Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. Today, we are talking about medical uses for vitamin C at doses far higher than those needed to prevent scurvy. You just heard Dr. Harri Hemila speak to us from his office in Helsinki, Finland, about the evidence supporting vitamin C for treating respiratory infections like colds. His research has been published in the Cochrane Database of Systematic Reviews, as well as a number of other medical journals. You'll find links in the show notes. The podcast of this show has extra information from Dr. Hemila about zinc as well as vitamin C.
We turn now to another aspect of Dr. Linus Pauling's research: high doses of vitamin C in the treatment of cancer. At the time, many American physicians considered this idea heretical. But you might be surprised to learn about the latest research. Dr. Joseph Cullen is professor of surgery, gastrointestinal surgery, and radiation oncology at the University of Iowa College of Medicine. He is vice chair for research in the Department of Surgery. Dr. Cullen and his colleagues published a fascinating randomized trial involving high-dose intravenous vitamin C in combination with chemotherapy for metastatic pancreatic cancer.
Welcome to the People's Pharmacy, Dr. Joseph Cullen.
Thanks for having me.
Dr. Cullen, we're so pleased to have the opportunity to talk to you about your research. You're a surgeon, and you're a professor of radiation oncology, and you have published a fascinating paper about intravenous vitamin C as an adjunctive treatment for pancreatic cancer. But first, could you please tell us a little bit about this kind of cancer and why it is so challenging to treat?
Sure. The problem with pancreatic cancer is two things, basically. First of all, it goes undiagnosed for such a long time, and the symptoms can be very vague. So it's hard for physicians to, diagnose pancreatic cancer. And then when it's diagnosed, it's usually metastatic or stage 4 at the time and really inoperable. And that happens in about 80% of patients with pancreatic cancer. And then the second thing that's so difficult about it is it's difficult to treat. When you look at cancer treatment in the last 20 years, there's been tremendous strides made in like breast cancer treatment and lung cancer treatment with some of these immunologically targeted drugs. But pancreatic cancer has kind of been left behind. We use the same medications, chemotherapy that we've used for 20 plus years. And some of the trials in pancreatic cancer have shown basically that some of the chemotherapy cocktails, you would say, can help, but they're very toxic and they're very hard for patients to sustain treatment with.
Now, the research, as Joe mentioned, that you have recently published has to do with intravenous vitamin C. And I think that that's really not a standard treatment. How did you decide you really needed to look at vitamin C of all things?
Well, this goes back about 15 or 20 years, and our lab was investigating different treatments for pancreatic cancer. And a colleague of mine, Gary Bittner, who had had a long career in studies of vitamin C, he had a colleague at NIH, Mark Levine, who showed quite nicely that if you take oral vitamin C, just like, orange juice or vitamin C tablets, you only obtain about 150 micromolar levels in the blood. But when you give it IV, you can give very, very high doses, and it goes up to millimolar levels. Because the body, if you take it orally, the body has a way of just really regulating how much vitamin C you get. It either stops absorbing it or it excretes it through the kidneys. So you're always going to be about 150 micromolar in the blood. But when you give it IV, as Dr. Levine showed, you can get really high levels. It kind of overwhelms all those other mechanisms. And he had done some studies showing that at high levels, it might kill some cancer cells. So he came to the University of Iowa, gave a talk, and we thought, oh, this is, heck, let's try it. And we tried it, and it worked just wonderfully. It was the best stuff we had ever tried before. We'd only had the cells, only given to the cells for like an hour, and it killed all the cells. So we thought, oh, we screwed up. And we did it again. It killed all the cells. We started backing down the dose, and then we could see that it was actually working quite well.
Now, wait a minute. Hang on just a second, Dr. Cullen. When you say it killed all the cells, are you talking about cancer cells?
Yes, cancer cells in a dish, in like a petri dish.
Okay, so this was like tissue culture of
Yes.
cancer cells. And
Yeah.
And I'd like to just clarify one other thing. When you talk about micromolar and millimolar, those are not measurements that all of us are super familiar with. So what you're talking about is just like a complete order of magnitude difference, right?
Yeah, 1,000-fold difference.
Great. Thank you. Carry on.
So
Yeah.
you started with the cells, and then what?
Then we tried it in a couple of our in vivo models in mice, and it worked really well. And so we thought, well, let's try it in humans. Let's do a human protocol and see if it's safe. And a phase 1 trial looks at safety and tolerability. And we had one of our medical oncologists, Dan Burke, who said, yeah, I'll give it a try. A lot of the other oncologists said, no, this is crazy. You guys are nuts. This is never going to be done at the University of Iowa. And really, it took one medical oncologist who treated pancreatic cancer to say, yeah, let's give it a try. So we tried a phase 1 trial, and patients tolerated it very well. We had one patient that lived 2.5 years on the trial, and the median survival for her stage of pancreatic cancer was like 8 months. So
Wow.
we thought, yeah, I know. So we thought, well, that works pretty good. Then we tried it with, we never are going to think that vitamin C alone may help patients. It might, but really you've got to combine it with standard of care chemo or radiation therapy. So the next study we did, we combined it with radiation therapy because about 30% of patients with pancreatic cancer get treated with radiation therapy. And the results for that were even better. And we did another phase 1 trial looking at a vitamin C with radiation. And in 14 patients who we tried this on, 3 of them are still alive 9 years out.
9 years?
Yes, and doing well with no signs of recurrence.
That's extraordinary.
Yeah, we thought so too.
Well, let's dial back to 1976, 77, 78.
You mean, Joe, you're not going to dial all the way back to 1932?
I'm just going to start with Dr. Linus Pauling.
Yeah.
And Dr. Pauling, not only was he talking about vitamin C for the common cold, But he was talking about intravenous vitamin C for cancer. And I remember in 2008, Dr. David Gorski said, vitamin C for cancer? That's a zombie idea. That's pseudoscience. That's nuts.
Yeah.
Just like some of the folks in your department. And now you're kind of demonstrating that Linus Pauling may have been right.
Yeah. So he did some of the early studies with high dose vitamin C in the late 70s with actually a Scottish surgeon. And the results looked kind of promising, but they were given it orally and IV. And then there was a study, Charles Mortel, who was a famous medical oncologist at the Mayo Clinic, did 2 randomized studies of oral vitamin C in patients, and he showed no difference. And you look back and you think, of course he showed no difference because they were oral vitamin C. And then it was up, then it came down to Dr. Levine at NIH, who showed, quite nicely that oral and IV is totally different. And, some people thought Linus Pauling was crazy, but we actually have a mechanism. We know why this works.
Oh, well, tell us about that.
Well, if you give it at very high, so everybody thinks of vitamin C as an antioxidant, right?
Yeah.
I mean,
yeah.
you see ads on TV, it's an antioxidant,
And if you're taking it in your orange juice, it probably is, right?
Right, exactly. It is. But however, when you give it IV and you give it the doses we give, up to 75 to 100 grams IV, it becomes a pro-oxidant. So it's just the opposite of an antioxidant. And we know that so what happens at those high levels is ascorbate, vitamin C, makes hydrogen peroxide, just simple hydrogen peroxide.
Okay.
And the hydrogen peroxide is what kills the cancer cells. They can't handle it.
Aha. Now, Dr. Cullen, what I would love is for you to describe this most recent trial that you have published of intravenous high-dose vitamin C together with chemotherapy in your pancreatic cancer patients.
Sure. So this is a trial. We randomized the patients. And so when they came to the clinic and they had this terrible diagnosis, we offered them either you can do the standard of care chemotherapy or you can do standard of care chemotherapy, and then we'll give you IV vitamin C 3 times a week. And so in our randomized trial, what we showed was that the median survival, if you just got the standard chemotherapy, was about 8 months. And that's consistent with the literature and with other studies, about 8 months. But when you gave IV vitamin C along with the standard of care chemotherapy, you doubled survival to about 16 months. And not only did you double overall survival, you doubled progression-free survival. So the patients did not progress as quickly when they are on the IV vitamin C. So we were thrilled. We actually, what we had done, which looking back was kind of a good idea, but we didn't realize it, we wrote in an interim analysis. And we said that after so many deaths, we're going to look at the data and see if it's actually working. Because if the data shows it's not working, you don't want to subject other patients to a trial that it's not going to work, right?
Right.
So we got to 26 deaths. We looked at the data. We sent it to our statistician, Brian Smith, a great guy. And he calls us, he said, it really works. It's significantly different. We went from 8 months to 16 months. So even though it was a small trial, we had like 34 patients in it. There was a 97% chance that if we continued the trial, the same result would happen. So we thought, well, we can't continue the trial if we know the same result's going to happen. That's not ethical. So we stopped the trial and then we published it.
Side effects. Are there side effects from this very high dose vitamin C?
And my question actually follows that, and that is, how did people feel on this massive IV dose of vitamin C?
They feel pretty good, actually, and I can't explain why. The biggest thing they have, though, the biggest side effect is they're very thirsty. When you do the infusions, they become very thirsty. And the reason why is because it's a huge hyperosmolar load or a huge salt load when we give it to them. And so they become thirsty. But when you stop the infusions, they don't have that thirst anymore. The side effect we worried about the most was the formation of kidney stones. But in this trial, we didn't have any patients that had kidney stones. But you could theoretically form kidney stones if you had a high dose vitamin C, but we haven't seen any in this trial. So we are pretty happy about that. Those are the biggest side effects.
And Dr. Cullen, how have your colleagues responded to this research? Because I think an awful lot of physicians have been trained to think that all you need when it comes to vitamin C is a glass of orange juice once in a while. And, it doesn't work for the common cold, and golly, it couldn't possibly work for cancer.
Yeah. So my colleagues at the University of Iowa loved it. After those naysayers either retired or left, we've had a lot of protocols looking at different cancers, and had some good results too. So they are on board. I would say that my colleagues, medical oncologists and others at the University of Iowa, are on board. I think nationally, it's still a difficult sell. It's still a difficult sell to have people understand how this works and why it works.
Why do you suppose that is, that there is such resistance? I know that Dr. Pauling's colleagues wrote about the resistance that they encountered after they published their first couple studies.
I don't know. I think part of it is it's so simple. It makes hydrogen peroxide, and we have the mechanism. It's not some fancy immunological change. It's not some pathway that nobody knows about. It's relatively simple. And it's easy to give, and it's cheap. And so that causes one problem, is that, big pharmacy companies, big pharma, they're not going to adopt this because they probably won't make any money on it.
Dr. Cullen, it's not just pancreatic cancer. You've actually studied vitamin C against another really horrible cancer, glioblastoma.
Yeah. So my colleague, Brian Allen, who's the chair of radiation oncology at Iowa, has really spearheaded this approach. And so they give vitamin C during radiation for brain cancers. And after they finish the radiation, they give vitamin C2. And he showed quite nicely in a phase 2 trial. It wasn't randomized, but a nice phase 2 trial with over 60 patients, that it increased overall survival significantly there too. So, we're thrilled about that study also.
You're listening to Dr. Joseph Cullen, professor of surgery, gastrointestinal surgery, and radiation oncology at the University of Iowa College of Medicine. Dr. Cullen and his colleagues published a fascinating randomized trial involving high-dose intravenous vitamin C in combination with chemotherapy for metastatic pancreatic cancer. You'll find a link to it in the show notes for today's interview.
Terry, these results are nothing short of astonishing. Glioblastoma, like pancreatic cancer, has a very bad prognosis.
Exactly. These are both extremely difficult cancers to treat.
The dose is not do it yourself. You can't do this at home orally. 75 to 100 grams has to be done intravenously in a hospital. Obviously, these folks know what they're doing because they've been doing this research for a very long time.
Yeah, for about almost 20 years.
It's time for a short break. When we come back, we'll continue our discussion of the effects of adding high-dose intravenous vitamin C to the treatment protocols of two really tough cancers, pancreatic cancer and glioblastoma brain cancer.
You've just heard that this can improve survival time significantly. How is it working?
In addition to making cancer cells more vulnerable to radiation, vitamin C seems to help healthy cells tolerate it better.
We don't expect that every cancer will respond. Scientists will need to do lots more research to figure out which ones do.
When might this approach make it into clinical practice?
What might medical oncologists conclude from this research?
It seems these studies vindicate Linus Pauling.
You're listening to The People's Pharmacy with Joe and Terry Graydon. Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. Vitamin C was discovered almost 100 years ago. At first, scientists were very excited about the properties of this essential nutrient. Besides preventing scurvy, it plays a critical role in many other biological pathways. By the late 20th century, though, most physicians were, I think, less interested. When Dr. Linus Pauling suggested that vitamin C might be helpful, not only against the common cold, but also for treating cancer, they scoffed at his ideas. Some even labeled him a crackpot and a charlatan. Now, however, research is beginning to vindicate Dr. Pauling's ideas.
Our guest, Dr. Joseph Cullen, is professor of surgery, gastrointestinal surgery, and radiation oncology at the University of Iowa College of Medicine.
Dr. Cullen, you have described both two of the most challenging cancers for oncologists, pancreatic cancer and glioblastoma. Tell us just a little bit about what the prognosis is with glioblastoma as you have with regard to pancreatic cancer.
So for glioblastoma, the median survival is just over a year. And this one kind of hits home personally for me. I haven't told this to many people, but my dad died of glioblastoma.
Ah.
And
Sorry to hear that.
Yeah. And this was in the 70s. And so the treatments were pretty poor. And he survived maybe about 8 months. But so I think we have two patients that are long-term survivors now of glioblastoma, or actually Dr. Allen does. So I think there's something there too. I think we're making some inroads on this terrible, terrible cancer.
Well, when you say long-term, how long are you talking?
Well, they've been alive for a couple of years now, and no signs of recurrence.
Wow. I mean, what you're describing, if it were a brand new drug, would be making headlines all around the world, because glioblastoma patients, as you point out, usually don't last more than a year, if that. And I have to tell you, my best friend died of glioblastoma, or the results of glioblastoma treatment, which were really pretty horrific. And Senator Kennedy, Ted Kennedy died of glioblastoma. And
John McCain.
Yeah, John McCain. And we're right next to Duke, which has, been at the forefront of glioblastoma research. But
I don't think they're using intravenous vitamin C. Maybe they should be.
And I don't think they have patients who have survived the way you're describing, just two, but nevertheless, that's quite extraordinary. And the idea that somebody has lived 9 years after treatment with high-dose vitamin C and pancreatic cancer is also breathtaking.
Yeah.
Now, when you write about the glioblastoma study, you suggested that what the vitamin C is doing is protecting the healthy tissue and making the cancer cells more vulnerable to radiation. Can you explain to us how that works?
Yeah, so we showed that in our pancreatic cancer studies with radiation. So as I said before, one of the treatments is prior to an operation, you might get radiation and chemotherapy. And so we took those patients that were going to get radiation and chemotherapy, and we compared those to those that got vitamin C and those who did not. And when the tumor hopefully shrinks with the radiation and chemotherapy, then you do what's called a Whipple operation, which is a pancreaticoduodenectomy. So you take the head of the pancreas out. huge operation, but you have to take the duodenum out too. And so what we did was we looked at the duodenum and the damage to the duodenum in the two groups of patients. One group had the standard radiation chemotherapy. The other group had standard radiation chemotherapy and vitamin C. And we showed in some different scientific parameters, I guess you would say, that the patients that got chemotherapy, their duodenums were not injured as bad. And so the duodenum is normal tissue. And so we show quite nicely that the radiation effects, which are significant to patients, no matter what kind of tumor they have, the effects are less to the normal tissue when you get ascorbate, when you get the vitamin C.
Now, tell us again what the dose of IV vitamin C or ascorbate is in kind of a milligram or gram basis so that people have some idea. Because, I think the RDA, the recommended dietary allowance, is about what, Terry, 60 milligrams?
Something like that. I'm not remembering exactly, but yeah, it's somewhere around there. It's under 100 milligrams per day, oral, to prevent scurvy.
Yeah, right. Yeah. We don't see much scurvy around too much anymore. But so if you go to Walgreens or CVS, you can get those vitamin C tablets that are about 250 milligrams.
Yeah.
And no matter how many you take, you're only going to get about 150 micromolar in the blood. But what we give, instead of 250 milligrams, we give 75 grams.
Now, that's 75,000 milligrams.
Yeah. Yeah.
So just for people who are not familiar
with the metric system,
we're talking 60 milligrams, 100 milligrams, maybe 250 milligrams orally versus 75,000 milligrams intravenous. It's like a world of difference.
Yeah, huge difference. And so that's where you're talking about differences. But, like our study, our randomized trial, we showed that the patients tolerated pretty well. And it allowed them to get more doses of chemotherapy for a longer period of time. So not only did it I think it kind of blocks some of the bad side effects of chemotherapy, and it allows patients to get chemotherapy for a longer period of time. So not only does we know that the IV vitamin C kills the cancer cells, but it also may allow patients to get chemotherapy for longer periods of time, therefore do better.
That sounds like an extra benefit because, a lot of times the rate limiting step is that the patient ends up at a point where they can't tolerate any more chemotherapy.
Yeah, right. Exactly. And some of the trials in pancreatic cancer, there was a famous one in New England Journal of Medicine 2013 where they looked at FOLFIRINOX, a combination of multiple chemotherapy drugs, and it did increase overall survival. However, up to 40% of patients couldn't tolerate it. So it's pretty toxic.
So, Dr. Cullen, you've picked on two of the worst cancers, glioblastoma and pancreatic cancer. They're killers. What about other cancers? Is it possible that intravenous vitamin C might be beneficial?
It might be, yeah. Yeah. So we have a current trial on lung cancer that is almost finished, and we'll know about that soon. But if we've done this in a very systematic way, I would say, is that we've done preclinical studies to see which cancers might be susceptible to IV vitamin C. And there was a study just done at Johns Hopkins, and Dr. Levine was on the study, where they looked at very end-stage prostate cancer.
Okay.
And they gave IV vitamin C, and they showed no difference in those patients.
So when you say preclinical studies to determine if the cancer is going to be susceptible, preclinical is like those cell culture studies you were talking about, or the mouse studies, right?
Yeah, exactly.
And so somebody jumped right into a prostate cancer study and didn't find it helpful.
Right. Yeah, exactly. And it was a well-done study, smart people. So I don't think, some people would say, well, there you go, it doesn't work. But, it might be cancer specific. And if you got a lot of preclinical data to support that it works, you'd have to see in patients.
Well, I'm wondering about any listeners who may say, well, my Aunt Margaret has glioblastoma. Why couldn't she get intravenous vitamin C? She's up at Mass General, for example, or somebody maybe at UCLA. I mean, when do you think your research will make it into clinical practice?
Yeah, I don't know. I think one of the things that medical oncologists have told me, the reluctance is that if they give IV vitamin C, it's going to counteract the chemotherapies or the radiation therapies they're using. And our studies have shown just the opposite. It actually works synergistically with those. So there's a lot of misinformation, I guess, out there about vitamin C. They still think of it as an antioxidant, and therefore it's going to reverse any beneficial effects of the chemotherapy in killing cancer cells. And our studies just don't show that at all. I think that's the biggest reluctance for medical oncologists out in the community.
Well, that actually leads me to my final question then. Dr. Cullen, what are you hoping that medical oncologists and other cancer researchers will take away from your studies? What future research are you looking for?
Well, what we would like to do is a phase 3 trial looking at more patients and maybe a multi-institutional trial. So our trial that was just published was done mostly at the University of Iowa and Medical College of Wisconsin. So one of the downsides, I guess, of our trial is that it was it was not a very diverse population. Midwesterners, mostly white people. And so it would be nice to be able to do it in a number of institutions where you look at a more diverse population to see if the results pan out.
Is this the kind of thing that NIH is willing to spend money on? I mean, it seems to me that this is a very big bang for your buck. The cost of intravenous vitamin C has got to be a fraction of some of our latest and greatest new cancer drugs that can cost literally tens of thousands of dollars per injection. So, is there going to be funding for the kind of research that you and your colleagues need to do?
Well, NIH does not fund phase 3 trials. And I wish they did, but they don't. Usually phase 3 trials are funded by a big, Eli Lilly or Pfizer or something like that.
The pharmaceutical firm, yeah.
Yeah, pharmaceutical industry. And just the background and people involved doing kind of all the nuts and bolts stuff it's just huge for a phase 3 trial. So I sure would like to see it go that way, but it's going to be difficult unless we get some backing to do it.
Well, it sounds like you are ready for some foundation, like the Gates Foundation or some other philanthropy organization or individuals with very deep pockets to say, wait a minute, Dr. Cullen, we've got $50 million that we're ready to give you for a phase 3 clinical trial. This research deserves your support, our support for your research.
Yeah, that's exactly right. I'm not going to hold my breath, but
good idea. You might turn blue.
Well, we would love to see that happen. I guess the other question I have, besides the funding and the ability to proceed with a very large trial and get colleagues all across the country excited so that they're willing to consider what you're doing, is this idea of kind of looking back on someone like Dr. Linus Pauling, who was made fun of. I mean, when people call his research pseudoscience, you've now proved that it was real science and it was innovative science and it was way ahead of its time. And I wonder how many other scientists have been discredited inappropriately because it didn't fit with the major paradigm at the time.
Yeah, for sure. I think he was onto something. He attributed to the vitamin C making collagen and stuff like that. And it does, but we found, we've known the mechanism. Others have shown the mechanism, and when you have a mechanism, you know how it works. I think that adds to the credibility of it.
I absolutely agree. It's very reassuring to have a mechanism, although sometimes we discover that what we thought was a mechanism turns out maybe not to be the whole story. What should our listeners take away from our conversation today?
Wow, that's a good question. I guess the big, probably two things is medical research actually does help patients. And some of these trials, some of these studies can be done not by individuals, but like in a team approach. And I would have to say at where I'm at the University of Iowa, we have phenomenal colleagues and phenomenal team approach. And I'm talking here today, but behind me are 30 people who worked on this, including medical oncologists, our nurses, our statisticians, our people that have to deal with the IRB and the FDA. It's just a huge team effort.
Well, thank you so much to you and your team for all this hard work. Dr. Joseph Cullen, we really appreciate you talking with us on the People's Pharmacy today.
Yeah, thanks a lot.
Well, thank you. And we admire your work. We admire your ability to take on a challenging topic and to stick with it as you have now for a couple of decades. Thank you so much for talking with us.
You're welcome.
You've been listening to Dr. Joseph Cullen, professor of surgery, gastrointestinal surgery, and radiation oncology at the University of Iowa College of Medicine. We have a link to his research in the show notes. Earlier in the show, you heard from Dr. Harri Hemila, senior researcher, principal investigator, and adjunct professor at the University of Helsinki in Finland. He's done meta-analyses of vitamin C for the common cold. There again, we link to that research in the show notes.
Terry, I hope other researchers around the country will pay attention to Dr. Cullen's work and begin to explore vitamin C. I know a lot of people will go, wait a minute, 75,000 milligrams of IV vitamin C? That's crazy. That would be terrible. But he says that people with really serious cancers like glioblastoma and pancreatic cancer actually did better on the vitamin C.
Definitely did better on the vitamin C. And of course, chemotherapy for these cancers is also very toxic.
It is. So it's
vitamin C, not so much.
Time for NIH to actually figure out a way to sponsor phase 3 clinical trials. Lynn Siegel produced today's show. Al Wodarski engineered. Dave Graydon edits our interviews. BJ Liederman composed our theme music.
This show is a co-production of North Carolina Public Radio, WUNC, with the People's Pharmacy.
Today's show is number 1431. You can find it online at peoplespharmacy.com. That's where you can share your comments about today's interview. You can also reach us through email, radio@peoplespharmacy.com.
Our interviews are available through your favorite podcast provider. You'll find the podcast on our website on Monday morning. On this week's podcast, we have more information from Dr. Hemila about treating the common cold with supplements like vitamin C and also zinc. When you consider zinc for treating a cold, you need to distinguish between tablets and lozenges. The form of zinc also matters, since zinc citrate doesn't work. I hope you'll find the information as fascinating and useful as we have.
At peoplespharmacy.com, you can sign up for our free online newsletter to get the latest news about important health stories. When you subscribe, you also have regular access to information about our weekly podcast, so you can find out ahead of time what topics we'll be covering. Speaking of the podcast, we'd be so grateful if you'd consider writing a review of the People's Pharmacy and posting it to the podcast platform you prefer. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening. Please join us again next week. thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.